Hello, everybody. Welcome back to Creating Haley. I am Kimberly at Creating Haley, and today is Massage Monday. So, today's topic is acupuncture, and I chose acupuncture today because I received an acupuncture treatment today, and I think many people don't know a whole lot about acupuncture. They might be a little put off by, oh, I don't like needles, or they don't really know what it's for or what it's about. So at work, we got a new acupuncturist on staff, finally. Yay. And she is fantastic. I love this lady. I'm not sure if I can tell you her name yet. She wrote a book, and so she's an author, and, she's looking for clients, but I didn't tell her I was going to do this. This isn't really a podcast, but this YouTube channel video. So I want to get her permission first before I do anything, say anything else. But anyway, she's fantastic. So I just thought maybe the topic of acupuncture might be of interest to somebody out there. So I want to talk a little bit about the history of acupuncture, who can receive it, who does it, who's the practitioner, maybe like what conditions you can get acupuncture for, and maybe some to stay away from, and like what the whole process is like, so that it's not scary for some people. So let's delve into that. So basically, acupuncture is using little needles. It's puncture. It's using little needles on the skin in specific points on the body, meridians. So let's backtrack. So acupuncture is basically an ancient medical practice that originated in China over 3,000 years ago, probably 6,000 BC. So let me take a quick look at my notes here so I get that right for you. Before the needles were invented, sharp stones and sharp long bones were used, and that was around 6,000 BCE. So acupuncture has been around for a long, long time. It hasn't been the exact same thing it is today, but it was, it's been around for quite a while. In fact, some of those instruments that were used in acupuncture were probably used in like their surgeries too back then. So like little things like lancing abscesses, I can't talk. I'm still all nasally from whatever cold I had. So, it's getting all, I'm sorry about that. And that's one of the reasons why I saw an acupuncturist today, because I really want to like clear out the chi. I want to clear out whatever's going on in my body. But let's go back to the history of it. So the tradition of acupuncture, it moves energy through the body. So there are energy pathways that have been determined. You can consider them like super highways, like in the body. These meridians, these energy pathways that flow energy, and they create balance and health in the body. And when they're blocked, then you don't have balance. You have, an imbalance of something going on, and also your health can take a hit. So this energy is called chi. It's pronounced chi, but it's spelled Qi, chi. So it's believed that acupuncture moves this chi throughout the body, and there are 12 main channels, these superhighways, 12 main ones known as meridians, the superhighways, the meridians. So they represent the major organs and functions in the body. So if we have blocked chi or blocked energy, and those major highways are not getting signals to the correct organs where they need to go, then you can kind of see how that might disrupt health, and then you get dis-ease. So the development of acupuncture, so let's kind of even go back even further. So the earliest documentation that refers to acupuncture procedures is in the Yellow Emperor's Classic of Internal Medicine. So that book dated 100 BCE. So it's, this is year 2023, so that's over 2,000 years ago anyway, where questions and answers were answered in this book, and that's like how acupuncture started to become written, and then procedures were just developed upon that later. So over the centuries, acupuncture has been developed until what it is today. So let's see. Between the 14th and 16th centuries during the Ming Dynasty in China, so that was 1368 to 1644, the Great Compendium of Acupuncture and Moxibustion was published, and that was the principle of acupuncture, and that was the principle of acupuncture based on what the modern acupuncture practices were based on, that published account. So it's been around for quite a while. And then so the rise in acupuncture, and then it kind of declined during the 17th century a little bit, with the advent of more modern, for that time, more modern medicine came about, and acupuncture kind of like declined, and then it started to make a rise again to what it is today. So let me see. In 1971, a member of the U.S. Press Corps was treated with acupuncture during recovery from an emergency appendectomy in China, and he described the experience as a success. So there you go. In 1971, some journalist was like, hey, I'm sick, I need acupuncture, and boom, he feels better, and so yay. Now everybody loves it. So that's kind of how acupuncture started, with like sticks and stones. Sticks and bones and stones. And then it became, what is today with those little teeny tiny needles. And that I would prefer that over bones and stones, I'll tell you what. So so the energy pathways in the body, they sometimes become blocked, and so when you open those up by hitting a trigger point, sometimes that's what a trigger point is for. Acupuncture is hitting that trigger point with a needle. So you're going into the skin, and you're hitting those like trigger points with a needle. So that goes, puncture is puncturing into the skin. Now acupressure is using the same concept, but no needle. You're just using some kind of, maybe a finger or a device of some sort to hit the pressure point. Now, the practitioners of this today are licensed practitioners. They have to undergo a lot of education and a lot of training to become qualified in order to practice this type of traditional Chinese medicine. Basically is what it is, TCM, traditional Chinese medicine. And then there's also another kind of practice called Western medical acupuncture, which is probably the same thing. It's just I don't actually know. Actually, I gotta tell you, I don't really know the difference. But the Western medicine has to be rooted in the TCM. So anyway, the practitioners of this have a lot of education, and they need to be licensed in order to practice acupuncture. Nobody can just take like a weekend seminar and become an acupuncturist. And if somebody has done that, which I don't even know if that's even possible because the schools are very lengthy, I would say don't go to that person. Maybe stay away until they get a little bit more education and a little more practice under their belt. But the recipients of acupuncture, so we know, the practitioners of it have to undergo a lot of training. But what about the recipients? Who can get acupuncture? And the answer is pretty much everybody. So from infants to elderly, from, maybe even newborns, but definitely the very, very young to the very, very old, and everyone in between can have the ability to receive acupuncture. Even pets can get acupuncture, although I probably wouldn't move muscles around if there's a needle sticking in there, because it can be a little bit painful. But as long as they're calm, they can receive acupuncture as well. So yeah, even animals too. So it's not just us humans. It's good for everybody who has chi, and pretty much all mammals have chi. So any mammal can get acupuncture if they'll be patient enough to receive it. But yeah, I probably wouldn't acupuncture an elephant with those teeny tiny needles. I don't even know if you're gonna be able to get those needles through their tough skin. But you have to be healthy enough. Now I know, like, acupuncture is used to treat the sick, but you have to be kind of healthy enough to receive acupuncture. So bleeding disorders, some infections, you probably don't want to be getting acupuncture if you have something like that. But what you'll need to do is go see a qualified practitioner. Then you have an intake form, and they will say, yeah, you're a good candidate for this, or, oh, you know what, maybe until that other thing clears up, or you get doctor's permission, then you can go seek acupuncture. But pretty much anybody, I think, yeah, just go see it. I'm not the expert in that, so just go seek a professional. So what is an indication and a contraindication? So let me define indication and contraindication. Some of you already know an indication would be something that you have that would be a great indicator to receive that therapy. So if I have a head sinus cold, for example, acupuncture is fine. I can get acupuncture treatments with a head cold. That's super. Now, if I had like a major bleeding disorder, probably that would be contraindication. So contraindication is something to avoid. So things that you can do. Pain relief is one of them. And that can be from like just muscle aches and pains to maybe headaches to even arthritis, joint pain. So pain relief is one. Another is stress and anxiety reduction. So you can see some of these overlap from massage and acupuncture, some of the same things. So people have stress, people have anxiety, people have pain, and they want to manage these chronic conditions. So maybe like another chronic condition could be allergies or asthma, or maybe some kind of digestive disorder, IBS or something along those lines. That is also an indication. Maybe fertility support. So if you're having trouble having children, or getting pregnant, the two parties of that, maybe whatever's going on, acupuncture might be helpful for that sort of thing. Rehab after injuries and surgeries is another one. So if you've had like a trauma or a surgery, and you're trying to quickly recover from that, acupuncture might be indicated in that scenario. Number 6, smoking cessation and drug addiction management. So if you're trying to get off those things, because they're very toxic to the body, acupuncture will help to heal, open up those meridians that have been blocked for decades, however long you've been smoking or using drugs. And even medication is a drug. Even chemotherapy is a drug. So you want to check in with your acupuncturist if you're thinking about that. And then emotional and psychological issues. So, depression or maybe insomnia. Those can be conditions that are indicated. And then here are some things that you might want to avoid. seeking acupuncture for. So again, I keep talking about, bleeding conditions. So maybe if you're on heavy blood thinner medications, maybe, talk to somebody about that. Pregnancy. So I just talked about fertility, but after you've already, gotten pregnant, there are certain points that acupuncture is a big no-no for that. Skin infections or open wounds at the acupuncture site. So, like for me, I had an acupuncture site right here. If I had like a pimple or something right there, she probably would not be able to stick the if I had acne right there, she wouldn't, because that's an open wound. Basically, it's an open sore. But if I had like an abrasion on my arm or wherever she was sticking in, like she had some needles in my hands, and I had like a cut or something, skin infection, something of that nature, avoid that. And then some medications. Again, we were talking about blood thinning, maybe uncontrolled high blood pressure might be another one. You want to talk to a professional about that. So it's really, really, really important to be open and honest with your practitioner. Try not to hide anything. And I've said this before in massage too. We need to know this stuff. We're not going to be blabbing it all out there. And any practitioner who does not keep your stuff confidential is not a professional therapist. So most therapists might ask, case studies. Hey, I have a client today who, has blah, blah, blah. What would you do in this situation? But we don't say, oh, yeah, Sally, she's crazy. We don't say that kind of thing. So just let your practitioner know, just like you would do your doctor. Just let them know everything that's going on, and then we can determine, oh yeah, that might be a good thing, or maybe I'm going to change up the therapy that I use and do something else. Maybe hands-on isn't the right option to use. Maybe Reiki energy is a better option to use. So let your acupuncturist know, everything that's going on, and they can make that determination. And then maybe even that will determine where they hit the acupuncture points. So just be open about that. Excuse me. So what would benefit from it? So I've already touched on some of this: pain reduction and management. If you have a little chronic pain thing going on, you can manage that with acupuncture. Say like it's an arthritis thing going on, so you can help with that. Improved circulation, and what I went for, immune function. So trying to get over a head cold. Boost my immune system a little bit. It just needs a little bit of help because this has been going on for a couple weeks. So I just want to, I've been taking my vitamins and my supplements, but it just needs a little bit of extra something. Stress and anxiety relief, I talked about that too. So maybe enhance sleep quality. So if you're having trouble falling asleep or staying asleep for a long period of time, maybe you're 7 or 8 hours if you're only getting a couple hours of sleep every night, or you have trouble falling asleep, or maybe you wake up with bad dreams, acupuncture might be able to help with that too. Hormone imbalances. So acupuncture can help regulate hormone imbalances, and that can be from adrenal fatigue too, thyroid, all kinds of hormones in the body. So that might be helpful as well. Just to try to promote an overall well-being is good. And then it can actually it can complement some medical treatments as well. So just talk with all your practitioners and see what's best, what plan they can come up with for you. So what to expect in a session. So basically you're going to have a consult. You're going to have all these forms to fill out. And don't go, I don't want to fill out all that. Just do it. And just be as thorough as possible. And even things you don't think might matter. Even growing up in your childhood, maybe nothing horrible happened to you, but like you never really felt part of the family, or there was like this one incident when you were like 5 or something, and you're like, I kind of remember that, and it didn't make me feel good as a 5-year-old. Bring that up too, because that could be hidden somewhere in your tissues, and that could be blocking energy also. And so they'll do an exam, and the exam is like they're gonna pay attention to your pulse points, and they might look at your tongue or something, and then they're gonna talk to you. Actually, they're gonna let you talk. They're gonna let you do most of the talking. And then from they'll determine a plan from whatever is going on with you, and then basically you just leave your clothes on and you just lay down on the table and just relax. And then they might put some points, whoever the practitioner is might put some needles in your hand, maybe like here was one point, in your head somewhere, like down by your ankles. So you just need to like pull your sleeves up and pull your pants up a little bit so your ankles are exposed. And that's kind of it. Now, she did put some on my back, so I had a session where I was face up, and then I had 15 minutes where I was face down, and she did some points on my back. So that can happen as well. She comes back in, she pulls all the needles out, make sure you're needle free, and then that's kind of it. And then they might recommend some herbal remedies, some teas. Maybe you need to do some kind of body cleanse or something, like a liver cleanse or whatever. They might give you something or suggest something. So, pay attention to that, and then know how often to take these things and how many days in a row that you should do it, or you should do it every other day, or like twice a day, or whatever the thing is. So always pay attention to that. And so the number of sessions will depend on what's going on with you. Now, I'm going to make an appointment with this acupuncturist every week. I want to be better fast, and I just want to maintain health. So one of my goals this year is to get my health back in order. So the fact that I even got sick this year, I haven't been sick in 3 years. So something's going on, and I just became overwhelmed. And that's because I'm working 7 jobs, I think, not sleeping very well and not eating right. So there's that. But that's just my personal thing. Yours is probably all different, but that's how that will go. And so I hope that helps you guys. And if you have any questions, leave your questions in the comment section. Or if you have any comments, or maybe you had an acupuncture session before, and it helped you with something, leave that. And if you want to share your story, please share. And yeah, I will try to get her to come on this channel with me, and maybe I'll create a different channel. Instead of it being on Creating Hanley, maybe I'll create another separate massage channel where I just do massage stuff. So I don't know, guys. Again, leave me a comment about that. Is that like, would you go seek information there, or do you like it all wrapped up into this one channel? I'm just kind of curious on that. All right, folks. Thank you for being here today, and go see an acupuncturist. I highly recommend any type of alternative therapy like that. I highly recommend. No, it's not covered under insurance. I'm sorry, it would probably be out of pocket, but you might be able to do an HSA account, a health savings account. You might be able to put that in, or at least the herbal supplements that are recommended. So, check into that. And different areas have different pricing, so I can't tell you how much it will cost because I don't know where you live, and I don't know how much it will cost. So you might want to budget for something like that. And if you're getting massage, you're going to budget for that anyway. So, just throw in maybe like alternate weeks. All right, folks, thanks for being here today. I love you all for joining me, and I'll see you on the next video. Okay, here's a heart for you. Bye for now.